Nobody wakes up in the morning thinking, I'm going to go to A&E today. Nobody knows. Nobody knows who it's going to be.
Paediatric trauma call, 15 minutes.
Code red, helipad response.
You're having a heart attack.
We want to be in and out of scan in the next 10 minutes.
I can't feel any pulse.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Beautiful. It's as if we've done it before.
We are there when awful things happen to pick up the pieces.
We have a 2-year-old who was kicked by a horse.
We see the unpredictableness of what happens in life, and we're suddenly having to explain why it's gone wrong.
I can't feel my left leg.
You'll be okay.
A place where life
A&E selfie!
Down below. Too slow.
love
Such a good boy. So proud of you.
and loss
I'm still here.
unfold every single day.
So we don't shake hands at this hospital, we fist bump. Can I have a fist bump?
All the patients you're about to see were treated in just one 24-hour period.
Hello, darling.
You genuinely do see the best of people in this job. You'll see strangers rushing to the aid of someone they've never met. You just see things that make you realise just how important the people in your life are and the people around you are.
Hello, Resus, Simon speaking. What is it you know so far?
Nurse Simon is just starting a night shift in Resus.
Yeah.
You're walking into the busiest time that the department experiences. It tends to be when you've got the most patients.
Fitzy, do you want to do 5 and 6?
You literally coming running.
Could David come to Resus, please? Ask David to Resus.
And then you eventually slow down as the night goes on. Although I do enjoy working in the night shifts, they definitely have their drawbacks. You don't get to see your friends and family so much. They've gone to work before you come home in the morning, and by the time they come home from work, you're getting up and going to work.
I woke up at 2, I couldn't sleep. So then I watched like 6 episodes of Orange is the New Black, and then got the chicken shop chicken they got it delivered to me at about 4.
When it's quiet and patient care is all done and you've got those downtime moments, you do find yourself getting into a little bit of mischief with your colleagues and finding ways to entertain yourself.
I did used to be a hairdresser, not just randomly.
Oh, gorgeous. There.
Yeah?
Yeah, I feel hairy, though.
Yeah, I know. Sorry, I can't do anything about that.
It may look like we let our guard down and relax on the night shift, but you never do. You're always prepared and always anticipating something happening.
St George's Resus. Priority, adult or paediatric? Okie doke.
A 31-year-old male is being rushed to St George's after collapsing at home during an epileptic seizure.
Charlie Foxtrot. Thank you very much. Adult male priority call, ETA 7 minutes.
It was his 4th seizure of the day, and he is yet to regain consciousness.
When you get that phone call that tells you someone's been having seizures, you need to make sure that you protect their airway, and you want to figure out how to stop the seizure.
Hi, can I have an adult trauma call to A&E Resus? Thank you.
You always need to be prepared for the next seizure that may happen with you.
The man's wife and mother have come with him in the ambulance.
We'd had a nice day, had a fun evening. We'd come back home quite late at night. We were just going to sit down and have some food.
We were watching TV, he was sitting on the sofa, and he just sort of went. Started to shake, then he like flew back and he stopped breathing.
Hello.
This is Liam, 31-year-old man.
Yep.
Since about 1:30, had 4 tonic-clonic seizures.
Seizures can be described in many ways, but the tonic-clonic are definitely the ones that put the patient at the most risk.
He is non-epileptic, but he wasn't really coming out.
Any family?
Yeah, a wife and his mum's here, yeah.
Perfect. Thank you very much.
He's had 4 fits, really bad ones. He can't take another one.
Epilepsy is an illness which is unpredictable. It just turns up when it wants to turn up.
They've told me today. They've said his head can't take it anymore, and his heart can't. His body could not take it anymore.
It's always in the back of your head. I could lose Liam through epilepsy.
So, Liam? Liam? Can I have some help, please? Ooh, he's having another seizure. Can you get me on this?
Is he known epileptic?
Yeah, he's had 4 seizures today. He's had 15 milligrams of IV diazepam with LAS. He had a post-ictal phase. GCS came up to 15 with me. Literally just stopped. Here you go, Liam. We're just going to pop this back down. Yes, please.
A seizure, when you experience it, is very, very scary.
1, 2, 3.
Liam. Pupils all over the shop.
It can be life-threatening in a very real way.
Liam, can you open your eyes?
Is he still fitting?
Open your eyes, Liam. Yeah, he's rigid.
Yeah, you can get wet. I'm getting wet.
31-year-old Liam came into resus 10 minutes ago after having 4 epileptic seizures at home. He has since had another. Nurse Simon is giving him an anti-seizure drug to stabilise his condition.
To have a seizure when you're up and about talking and, feeling good, to then having one when you're already feeling unwell and you're already knocked off from a previous seizure, that's when things can become very dangerous for a patient. You can't communicate with that person. You can't understand what's going on because they simply can't tell you. So it's the unknown entity of seizures that is the scary aspect.
Hello. Are you with Liam? Yes. Yes, hiya. My name's Dr. Krish. I'm one of the A&E consultants here. Hi. Are you his...
I'm his wife, that's his mum.
Oh, hi, nice to meet you. He's had another seizure with us here. We've started a medication called phenytoin that will hopefully prevent him from having another seizure. He'll need to come into intensive care because they need to keep an eye on his airway and everything. Okay.
Sure, thank you.
What have I let myself in for coming round here? I do not know.
But you need to get your foot sorted. If it's fractured, I think it's worse than a break, isn't it?
It's quite handy having your mirrored sunglasses because then I can use it to fix my French.
No mirrored sunglasses is going to be able to fix your French.
Nurse Sophie has been working shifts at St George's for 15 years.
The hardest bit is changing from night shifts to day shifts. And a lot of people find that it's very, very difficult to swap back to do day shifts. Somewhere along the line, you've lost a night's sleep. I do like 12-hour shifts. I do like having days off in the week. I don't understand why everyone has the weekend off and goes shopping. I find it amazing when I go off and it's all crowded. I love going when there's nobody there. Any reasons, how can I help you?
How does it affect your social life and your personal life?
I don't have a social life. And I have no personality, so that's fine. What do you want? That was my posh voice, but now, yeah, what do you want? George's medical trauma.
An 89-year-old woman is being rushed to St George's, suffering from severe chest pain and difficulty in breathing.
Thank you. Hello. Let me grab my bits.
Right, my love.
1, 2, 3. Did you enjoy the ride?
The woman's daughter has come to St George's with her.
She was staying here and Luke left her a little bell to ring if she wanted to go to the loo in the night. Her chest was completely rattling and I really was very worried about her.
8, 9, trained to rest at 9 o'clock last night. Learned of heart failure. I was here about 2 months ago. Was admitted. I was here for about 6 weeks.
Hello there. I'm Anna. I'm one of the other nurses. Do you mind if I take a blood test from you?
Is my daughter there?
I think she's in the relatives room, so we'll get her through in just a moment.
She was the oldest of 6. They were all born in the same house in Wales, which my uncle still owns. It was quite a theatrical sort of childhood. From 3 years old, she said we were encouraged to sing, dance. I know that everybody gets super dressed up and ends up on the stage. And I think that's why my mum's so confident.
Can you straighten your arm? That's it, lovely.
She would have probably fared well as an actress, actually, I think, my mum.
Right then, if you stay nice and still, sharp scratch coming up, all right?
When she was 21, she moved to London. She wanted the bright lights, basically, but she did get terribly, terribly homesick when she was in London, and she wanted to go back to Wales. And she said, I was determined to stick it out because everybody told me I would hate it.
I've done one blood test, but I need a bit more.
She was working for the telephone exchange. You couldn't make an international phone call without going through the telephone exchange those days. And she was chosen to open the lines after the war, which she found very exciting.
Okay, stay nice and still, sharp scratch.
It was France, actually, that she spoke too fast. This is France here speaking, and it was lovely, an amazing moment.
Right. Are you with my lovely... Yeah, we just get some bloods. She's doing great, it's lovely.
My grandfather's sister, she had a hotel in Hastings, and she met my father in the hotel. My father said the minute he saw her, he fell in love with her. She's...
Right. I'm going to put you back a bit. Right, lean back. How's that? More or less?
Lovely.
Yep.
Lovely, thank you.
Keep you decent.
I think they married after about 3 or 4 months of knowing each other, registry office wedding. So he must have been pretty bowled over with her, I think.
Here you go.
Feeling a bit better. I know, more blood tests now, yeah. They work well together. Well, they were married for 60 years, so they must have worked well together. You know, they, thick or thin, they got through it.
They've taken me off the oxygen now.
Yeah, but you're so much better now for breathing. You had to have that because you were feeling so terrible, weren't you?
Doctors will carry out further tests to find the cause of Mair's chest pain and breathing difficulties.
If you'd like to open your mouth, love, let's have a look. Let's have a look, see if I can see your brain.
You've got what's known as it's called a stress fracture or a march fracture. But it's due to the fact of walking. So it's more common in people like police officers, army, who are marching. And you need to give it the best possible opportunity to heal, and that is putting it into a plaster.
"31-year-old Liam was brought into resus just over an hour ago after having multiple epileptic seizures. Doctors have given him medication to try and prevent further episodes.
Liam. How are you feeling? You had another seizure. You told me you weren't going to do that. What's your wife's name?
Alice.
Alice. Good stuff.
Liam and I first met in a nightclub in Ipswich. He had a sheepskin coat on and some really not good shoes, which I thought, might have to change that possibly. But I remember my sister and I saying to each other, "Oh God, he's so good looking." And I remember Laura saying, "Alice, if you don't go over there, I am." And I was like, "No, you're not going over there, Laura, I'm going."
Just you and Alice at home, is it?
Yeah.
Good.
There was a moment, I think, for both of us where we felt like this bubble around us. I don't know what it was. There was something really special there. We both remember that really clearly. He proposed on a beach in Cornwall. We were going on our little caravan holiday. He knows that I don't like public, emotion very much. But I don't think Liam could really guess that I was going to react the way I did. You expect someone to cry or someone to, I just didn't react like that. I just reacted like, "Oh, yes, Liam, get up. Yes, of course I will, for God's sake."
Have you ever been admitted here to St. George's?
Numerous times.
Numerous times, OK.
When I first met Liam, he'd already been having seizures. His life is on tenterhooks with his epilepsy. When he has a bath, I have to make sure that I'm checking on him every few minutes, every 5 minutes, or at least calling out to him, just so I know he's not had a seizure in the bath and is drowning. You know, he's hit his head on sinks. He's had a knife near his face when he's fallen.
When he was at uni, he was at the top of those stairs, and he was lucky that he didn't break his neck. Oh, I dread that phone call one day where I might get a phone call from Alison. Maybe he's not going to pull through. So don't worry, every day. Every day.
Where's that been? I was at my friend's 40th birthday party on a boat, and my other friend turned into an animal, and I was asked to restrain her, and she bit me.
You need to come down the bed a bit. Keep going. That's it. This is driving me mad, this is. Shove it in the trolley. Oh, don't do that. Bad foot. Dearie me, I've come off and hit the other foot.
I'm afraid we need to keep you in the hospital.
Oh, no.
You can go out for fresh air if you want now and come back.
I'm gonna go for a cigarette and a glass of wine and come back.
Wine? No.
A Guinness?
No. No, just you can have fresh air and come back here, please.
Thank you.
All right.
Thank you very much. Thank you.
You're welcome. See you in a minute. George's medical trauma. One second.
A 12-year-old girl is being rushed to St George's after collapsing whilst playing rugby.
Thank you. SP. Out there.
The girl's mother and stepdad are on their way to A&E from West London.
John and I had been in London the night before, and we were just taking a very leisurely stroll back through Hyde Park when my mobile phone went.
It was a shocking moment. She just screamed.
I just had to calm down a little bit, and then my first thought was, I need to be with my baby. She needs me, and I know she's going to want me.
Okay, you coming in here?
I wanted to give her a cuddle, and so she knew her mum was there.
Paramedics have given Lauren gas and air to ease her pain.
Deep breaths, because when you blow it out, it stops working. That's it. Keep going. Make it whistle. It's okay. Perfect. Keep doing that. Keep doing it. Keep doing it. Deep breath. Deep breath. Good job.
Okay, can I have a handover, please? Yeah. You from this
12-year-old
side.
Lauren, normally fitting well. She's playing rugby today. Make a try. She's looking for her left leg to somehow give way and go backwards. Crackling sound like a gunshot sound was heard. Immediate pain and deformity to the left femur. Pain score initially 10 down to 5 or so with the injection.
We need chest, pelvic, and each of you.
Is there any pain on your chest when I'm touching you?
It's all on this side of it.
There were a lot of doctors and nurses around her bed. I think actually that's the point that freaked me out the most, because I then realised that actually it was a real trauma call.
Right. X-ray ready.
Lauren will now be taken for an emergency X-ray to assess the severity of her injuries. "89-year-old Mair was brought into resus 20 minutes ago, suffering from breathing problems and severe chest pains. Her daughter Janet has come to A&E with her.
Janet, you must be tired.
I'm all right, Mum, don't worry, I'm fine.
Doctors are waiting for the results of blood tests to see if she's suffering from pneumonia.
I'm gonna come back in again, see how you're getting on.
Well, we were brought up in Clapham. That's where, when my parents first bought a house, I was 3, and we lived just off Aberville Road. And my 2 younger siblings were born in that house. I have an older brother as well.
You didn't sleep good last night. Did you go and have a little kip this afternoon?
Only for an hour. My father bought a shop in Broomwood Road. We were the corner shop that everybody knew. They had an off licence as well, so they had many, many parties. And Mum especially was a very, very hospitable person. When it was party time, it was party time.
Dr. Tom has the initial results of Mair's tests and is concerned she has fluid on her lungs.
Hello.
Hi, my name's Tom, one of the doctors. Hi, how are you?
Hi, doctor.
Hi, how are you feeling?
Much better than I did a couple of hours ago.
Okay.
My body's failing, doctor, but thank God this still works.
Mum and Dad were very good providers, always had a lovely home. First kids in the road to have a television, first kids in the road to have a car. I can remember all those things. I mean, this is in the 50s, so not many people had televisions and cars those days. It was a nice childhood, a loving childhood. She always knew straight away if there was something wrong by my voice. I just felt she was always there for me. Proper mum, you know.
What are you able to do then at the moment? Are you able to wash and dress, or do you need help with things?
A bit of both, really. She likes to do as much as she can, but this morning she just really couldn't do it.
It doesn't have carers, it's just...
No, she has district nurses in, but no, my sister's been doing it.
Yeah. And obviously, with the heart problems, have they talked about options? Are they guessing they're not going to do another operation?
They said they can't do it. They don't want her to do anything intrusive, they said, because she won't be able to handle it, basically.
Sure. With your heart problems and things, God forbid it's not going to happen now, but if you were to get worse and your heart was to stop, do you feel that you would want a resuscitation, or
No.
would you feel that you would want nature to take
No,
it?
let me go, baby, let me go.
I don't think that's going to happen, but it's good to know what your thoughts are.
The do not attempt resuscitation order is there to say, if you stop breathing, if your heart stops, our focus is going to be on comfort and dignity, not on resuscitation.
No, let me go.
'Cause I don't-
If I make July the 6th, I shall be 90.
Wow, yeah, that's good.
Oh, I've had good innings.
I don't think that's going to happen, but I just wanted to check what
That's
you were
right.
thinking.
Oh, no, let me go.
Okay.
I thought she'd say that.
Thank you, doctor.
I think the first thing we'll do then is get an X-ray, and then I think it's going to be best for you to come into hospital for a day or two to try and get some of this fluid off.
I got my gin and tonic, so I'm all right.
I'm going to go and grab your wife.
31-year-old Liam has been in resus just over an hour. Doctors are monitoring him very closely after having suffered 5 epileptic seizures.
Cool, just through here. So I've popped some chairs here for you. Liam? Liam?
Lovey. Darling. I'm here, sweetie. Are you okay?
When I met Liam's dad, I did want to get pregnant. Because I wanted something to love. My parents split when I was 13. My dad was the love of her life. And she just could not get over it. We did drift apart.
You've got one of our pillows from home underneath you.
I started to play up myself. And I was skipping school. I got caught shoplifting. Started fighting. One of the most difficult parts of my life.
He's just exhausted. Poor thing.
He was just like a godsend. He really was like a godsend. Once I had Liam, that's what really brought my mum to her senses. She totally changed once I had Liam. We got closer. We were just basically joined at the hip, which was brilliant. They sent me to a special school for pregnant schoolgirls, which I did. I learnt a lot there. I had to grow up very quickly. For somebody of that age to have something grow inside of you, you know, you get this natural instinct of, I've got to look after this. Your whole world is focused on this baby.
We're going to be taking Mr. Lewis around to Richmond ward very shortly.
If Liam wasn't born, I don't know where I would be. Probably could have ended up in jail the way I was going.
Let's go.
I don't know what I'd do if anything happened to Liam. I don't.
Liam will now be taken to intensive care, where he'll be closely monitored in case he has further epileptic seizures. "12-year-old Lauren came to resus 30 minutes ago after collapsing while scoring a try in a rugby match.
Where's your ticket for the ride?
She's had x-rays of her chest, pelvis and a suspected broken femur, so doctors can determine the extent of her injuries. Lauren's mum Rachel and stepdad John are in resus with her.
John's just come to sit for a while.
You all right?
Okay? All right? Lauren was my first, and I wanted to have a little girl. I wanted to have what I have with my mum, actually, and that was the mother-daughter bond.
Just got messages from the girls' rugby team to say they won.
Did she actually score the try then?
Surely they gave it to you.
Lauren is a tomboy. She would always be the one up a tree or climbing on something, always kicking a ball around with the boys. So at the moment, I don't have that kind of relationship where we can go out shopping and, you know, doing the girly things, because Lauren doesn't want to do girly things. She doesn't want her nails painted or me to plait her hair.
So you don't want to play rugby anymore?
No.
You will.
When she was probably about 4, she started playing football with her dad. She then started horse riding. She was picked for the athletics team and cross country and netball. She lives to play sport, really.
Where is Arlen? All right, I'll tell the lady when she comes back and she might be able to... Is it worse since the X-ray?
Try and relax.
John's passion is rugby, and that kind of rubs off on Lauren. He's quite keen that Lauren does push herself as far as she can, really.
I just feel an overwhelming sense of pride when she does well, and when she's not doing well, I want to encourage her and want to continue to see her improve as a human being and going into adulthood.
Doctors are now examining Lauren's x-rays to see if she'll need an emergency operation to her leg to give her the best chance of walking normally again.
Because Lauren has played sport, you know, all of her life, I really did think that she was going to struggle terribly with it.
Just take your time.
You take your time, yes, yeah. Stop a bit, that's it. No rush.
No rush.
Time for a rest, that's it. All right, goodbye.
We'll go to the desk and make an appointment. You're going to have to. Just take it easy, all right? Take it easy, just take it. Don't rush, just take it easy.
"12-year-old Lauren came into resus just over an hour ago with her mum Rachel and stepdad John after collapsing whilst playing rugby. X-rays now confirm Lauren has a severe break to her femur.
It's stinging. All right, don't tell the lady a minute. She's complaining that this is stinging, something's stinging on her feet.
It's not comfortable, but what it's doing is stopping that coming together. Where's it hurting? Bone pain, I think, is one of the worst pains ever. Bone pain is horrible. It's like toothache pain badly. You get horrible spasms. But let me see if we get you some more painkillers. Guess what? She can eat and drink.
She can eat and drink? Are they not operating today, then?
No. I've got sandwiches and stuff, but there's a Marks and Spencer's round the corner that's got better stuff.
A bottle of water, a packet of crisps, and just get me something like chocolate or something.
Do you want me to get you a little bell so you can
Yeah.
ring it and demand her attention?
So, I've just spoken to the boss. The operation that we want to do is basically putting a plate with some screws in there to hold the fracture in place. Risks with surgery, as with any surgery that you do, there's risk of bleeding, a risk of infection, damage to nerves or vessels in the area. No contact sport for at least 3 months, we say.
I think it's your worst fear as a mother, is your children being injured.
Do you want some more painkillers now? We can give you a little bit more morphine if we need to.
She brings me happiness and love, and she's mine. I gave birth to her, and I carried her for 9 months, and I just want her to be happy and to just be true to herself.
Give it a minute or so, it should works quite quickly.
Can have a little sleep.
Hi, Lauren. It's been so long. I don't even want you to go, because I actually quite like looking after you.
Oh.
When I was about 25, I ruptured my meniscus in my knee and was told I have to have a partial knee replacement. They're not designed for 12-hour shifts. And that's what scares me, is I know that will be what stops me having to work in the ED. You got brothers and sisters?
Yeah.
I know, what?
I've got 2 sisters.
Oof.
2 stepbrothers and 1 stepsister.
How do you feel about that?
Just that what I do, just keep on going. Younger, older?
They're all younger.
Oh, you're the older. Get a bit of peace and quiet, aren't you tired?
Lauren will stay in a ward overnight ahead of extensive surgery in the morning.
Okay, Mair, so can you sit forwards for me? That's lovely, and rest back.
Are you doing it here?
Yes, we're going to do the x-ray here.
89-year-old Mair was brought into resus just over an hour ago with breathing difficulties and severe chest pains.
Chest x-ray, grade 7.
Doctors are taking chest x-rays to see the extent of the fluid on her lungs.
All done, okay.
It's all right?
Yes, all finished.
She's got very loud crackles all over her chest and swollen legs. I mean, she's quite comfortable. She's not needing oxygen or anything.
You were due to go to a nice restaurant in Knightsbridge tonight.
I'll go. I can go. What time you book?
It's 8 o'clock, I think.
Oh, I finish at 8. That could work out nicely for me.
When my first grandson was born, my mum said, I want to be called Gigi for great-grandma.
Are you going to wear that nice dress tonight?
I'm not sure yet, I'll see.
Hope you have a nice meal now then.
My daughter's named after her, so she's Mair too. Really, really close. She actually said once that my daughter Mair has added years to her life. She just watch her play and really, really close bond. It's lovely.
I'll be up in the morning anyway, okay?
Okay, love, enjoy your night.
Anywhere we went, she was always, we're 4 generations here. Always. Everyone had to know, because, I mean, obviously everyone's interested.
Hello.
Hello, my name's Sarah. I'm one of the nurses. I've just taken over, OK? Would you like
Have you got a cream cracker or something?
I can get you a cream cracker, yeah. Yeah? Do you want some cheese, butter, or just plain?
No, you can have a bit of butter.
Bit of butter, yeah. Give me 1 moment, I'll be back with that.
On my 60th birthday, I had my daughter, one of my granddaughters, and my mum in the same house. I mean, how lucky can you be?
So, Mair, they're going to take you to the ward now. Lovely to meet you. It's always good to meet a fellow Welsh man, well, lady.
I definitely enjoy meeting people and looking after people who are from Wales. It does make me miss home quite a lot. It was a real pleasure, actually, looking after Mair.
Mair will be admitted to hospital, where doctors will attempt to remove the fluid from her lungs and carefully monitor her condition.
The first afternoon I came in to see him, he looked a vulnerable little boy again, and I hate that. I really hate that.
Looking into the future definitely feels like it's going to be positive. I want to be able to drive. I'd love to be able to drive.
If he has a year without seizures, then he's allowed to then get provisional and start learning.
I'd love to be able to have a good career and can just live what people would consider to be a normal life.
I just really want it just the rudder to be removed now and just for me to be able to slowly work my way back into sports and just be able to do normal things that I used to be able to do.
think in many, many, many ways, I'm like my grandma. She was one of my best friends. I miss her.
She died 9 days before her 90th birthday, and we had the wake in a club that she wanted to have her birthday in. Apart from Mum, she was a friend, and I will miss her. But every time I do feel sad about it, I think how grateful I am to have had her for so many years.
The last thing she said to me, she held my hand and she said, "Kate, just have fun." And something switched in me, just clicked, and I was like, duh, of course, just have fun. That was the best advice.
Oh, ow, 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 it's coming in my wrist again. Since I'm really hungry, I think the sausage roll can sort that out.
Adult protocol, 20 minutes.
The main problem with internal arterial bleeds is that you don't always know how much bleeding is occurring.
I remember just thinking, please, just let this be okay.
Worst case scenario, you can bleed out, lose your blood volume and die.
There's cardiology on the way.
Thank you.